Midwives, they do a fantastic job, and they provide client-centered care to women in pregnancy, at birth, in labor, and then postpartum. And they also care for their newborn up to 6 weeks postpartum. It's all about the woman. It's all about her making the decision and also planning how she wants her care to be.
To be the midwife, the voice for other clients that feel very comfortable to talk about everything, that nothing is strange in terms of when they talked about their food, they talked about their cultural way of doing the ceremony when they are having their baby. It's something that I understand and I relate to, that I've seen being done. So it's not strange to me. So they feel very relaxed.
It's very hard to advocate for yourself when you're in such an all-consuming state. So having the space to build those relationships and get to know your clients ahead of time, to build that safety, I think is something that, I think is incredibly important, and I understand the place of it and the need for it so much more.
Before you can be a registered midwife here in Alberta, you have to be trained for emergency skills. We have the emergency training workshop, which is mandatory for midwives to update every 2 years, and the neonatal resuscitation program, which is every year. We're also trained to write prescriptions for medications that are pregnancy related.
Midwives are trained in breastfeeding. We give to our clients education about that before baby is born, and then we have home visits after the baby is born. So if our clients have any concern with breastfeeding, we help a lot. We do a lot of counseling about anti-conception, because after the baby is born, we always have the question, okay, what's the plan now? So we usually give the people information about what kind of birth control are available for them.
Midwives work with other healthcare professionals by collaboration. So we work with obstetricians, nurses, dietitians, physician, depending on what the need is at that point. We are not doulas, we are not just offering emotional support or emotional care, we're rendering health client-centered care.
As a midwife, when I'm working with other healthcare professionals, I find it really refreshing and exciting almost when people know what our scope is, they know what we do. So I think for other healthcare professionals, it's really fantastic when we meet somebody who is aware of our what midwifery is and has done a little bit of work to know the type of care that we provide.
Collaborative practice is to the benefit of the patient. It doesn't hurt, but it can benefit the patient in many ways.
As a nurse, I believe midwives and nurses could definitely work together.
Working with midwives is not as they see us, as if we don't think about things the way we do, but then when they get closer to us, it would elaborate how we work to them. They will understand us more, and they will know that, okay, we know our limits, we know when to get help, and we know when we want to give our clients choices of what they want. I would encourage obstetricians to look more into it.
What would make it easier to find a midwife would be if a family doctor would talk to you about it, give you the option, because they just automatically refer you to an OB. So for them to be able to say, hey, would you like a midwife or an OB? If so, these are the numbers and contact.
The thing that I didn't know when I started this whole journey was how much I would really, really love it. I expected to love informed choice and the advocacy role and kind of that, just not the clinical piece. And I really, really love the clinical piece. I love the science behind what we do. I love how traditional knowledge supports the things that we do and supports the evidence-based knowledge that we have. I love the engaging with people, and I love the just being on the ground with those folks who have probably never had that type of care before, and just really being able to provide the best that I can for those families.
My work or my life has been able to impact people on the positive side. My name is Joy, and that's like the summary of what I give back.